Are reportedly preventing thousands of samples from the Seattle flu study to be tested for coronavirus. It's an allegation raised in a New York Times story. KOMO's Matt Markovich has been tracking the progress of this landmark flu study and joins us live with the details. Matt?
Yeah, Mary, we spoke with the director of the Seattle flu study back in December when the flu study was just getting started. But now she and her team are involved in a controversy because they went ahead and tested for COVID-19 in those flu samples against state and federal guidelines. For months, Seattleites were volunteering swabs of their snot as part of a one-of-a-kind study to track the spread of flu throughout Seattle. But it's also the same kind of sample needed to test for coronavirus. The flu study had collected nearly 2,500, with a caveat.
Is that kind of information can be passed on to your personal doctor?
No, not unless people explicitly want to do it themselves.
We spoke with the director just as COVID-19 hit China.
We would not transmit the information to their provider or to anybody else. It would just be given to the person who did the test.
But the New York Times has reported federal and state officials told Dr. Chu and her team they could not test for coronavirus without the permission from the research subjects. They did it anyway, just a few weeks ago. Then Elizabeth Schneider says a flu study nurse called her,
saying that I had tested positive for COVID-19.
She's self-quarantining and knows of other flu study participants who got the call.
I was told that all of the samples that the Seattle flu study have been testing positive for COVID-19 have also tested positive through King County Public Health.
Other samples led to a positive test of a teenager and a temporary closure of a high school, and evidence that the virus was in Seattle weeks before it showed up in patients at the Life Care Center of Kirkland. But now, state regulators have reportedly stepped in and told flu researchers to stop testing their samples for COVID-19. The flu study's principal investigator now defending his team's actions, saying there are times when we have all felt the need to move fast in an effort to save lives. And we were unable to independently confirm whether Elizabeth has COVID-19. Flu study researchers did not respond to our request for comment, but I did get this email from King County Public Health, which told me because of the number of cases has increased so dramatically, they are no longer routinely conducting case or contact investigations for all COVID-19 positive cases. Reporting live in Seattle, Matt Markovich, KOMO News.
Plain. Now, so let's take a listen to this video here. It's cranking up. Be patient. And it's taking it a while, but it's cranking up. This particular browser so happens to be Microsoft's browser, so, you know, they're a little flaky. Well,
The Seattle flu study to be tested for coronavirus. It's an allegation raised in a New York Times story. KOMO's Matt Markovich has been tracking the progress of this landmark flu study and joins us live with the details. Matt?
Yeah, Mary, we spoke with the director of the Seattle flu study back in December when the flu study was just getting started. But now she and her team are involved in a controversy because they went ahead and tested for COVID-19 in those flu samples against state and federal guidelines. For months, Seattleites were volunteering swabs of their snot as part of a one-of-a-kind study to track the spread of flu throughout Seattle. But it's also the same kind of sample needed to test for coronavirus. The flu study had collected nearly 2,500, with a caveat.
Is that kind of information can be passed on to your personal doctor?
okay. All right. Now, I want you all to look at something. Okay. Now, I want you to think. Okay. Now, those of you who are exhibiting attention deficit disorder, all right, your mind is just bouncing everywhere. But I want you to stop. Just stop for a moment. Pay attention. Now, okay. Now, I want you to look at something. I want you to look at this date right here. You see that date? That's December the 13th. That's a few days after it was announced in China that some virus was devastating the population in the Wuhan area. Okay? Look at your screen, December the 13th. Now, remember that date because it's going to be important for where we're going. For Dr. Helen Chu, okay? She's the director of this program in Seattle. And this program, what they did for 2019, they were taking samples, storing it, like in test tubes and all, of people who evaluated as having the flu, of having influenza. They were using the same technique in many of the tests that are used now to detect coronavirus. You saw Donald Trump with that long, looked like a long Q-tip that is put into your nasal cavity, into your nose. And then they collect that sample that way. Well, in Seattle, what they were doing, and this was one of a kind now, probably the only one in the country, in other words, in 2019, not 2020, 2019. Seattle was doing this, collecting samples. Now, the CDC and the Food and Drug Administration had a problem with what the people in these laboratories were doing in Seattle. Now, if you don't get it yet, you will get it, okay? All right? You will. 13th. Chu is the director. They're carrying out these extraction of samples from people who evaluated to have had influenza, whatever type of influenza, whatever. They had influenza symptoms. They would take those samples and then they would store them. So long as whoever it was, if it was you with the flu, if you volunteered to have your sample taken and stored, then they would do that. So they did this. They did it for a few thousand people in the Seattle area. But let's go on here, y'all. Let's go on.
COVID-19 hit China.
We would not transmit the information to their provider or to anybody else. It would just be given to the person who did the test.
But the New York Times has reported federal and state officials told Dr. Chu and her team they could not test for coronavirus without the permission from the research subjects.
All right. Without permission of the research subject. Okay. Well, that was already clear anyway. The subjects volunteered for this. Now you had the CDC and the FDA who were getting in the way of this. Now, why were they getting in the way of this? The reason why they were getting in the way of this is because Dr. Fauci and all these other cats, they already knew that COVID-19 was spreading in the United States even before it was announced in China. Okay? Let's continue on with this. What you're looking at on your screen, this is one of the patients who had influenza in 2019. But you listen to what she has to say, y'all. Listen to this. Listen.
They did it anyway, just a few weeks ago. Then Elizabeth Schneider says a flu study nurse called her,
saying that I had tested positive for COVID-19.
Okay. All right. Now, this is before China now. Called her and told her that she had tested positive for COVID-19. This is not, and this was not the narrative that the CDC, the FDA, and I'm sure Dr. Fauci's area, the National Institute of Allergies and Infectious Diseases, this was not the narrative that they wanted to become public. Now, why? The reason why is because it would show that it all started here in the United States of America. Not China,